I'm going to go with it. Awesome. All right, so various methods of urine collection is random collection, early morning collection, clean catch midstream specimen. It's also a 24-hour collection where literally for 24 hours you're collecting into one big giant jug. Suprapubic, abdominal needle aspiration. So what do you think's going on here? Let's break down this word. These are two great words to break down. So let's start with suprapubic. What do you think if we were to break that down? Above pubic, yes. So ic is our area, so it's pertaining to the area, supra, above the pubic area. And then transabdominal, what do you think we're doing there? Through, yep, through the abdomen, through or across, right? That's trans. Very good. Catheterization, obviously we're using a catheter in that point. Beautiful. Terminology. State the meaning of each term. What do they have in common? So we have glycosuria, ketone, and nitrite. Excuse me. Saying that wrong. So in this case, what do you think glycosuria is? If we had to guess, and you had those word parts in there, what do you think? We know we have urea, and that's urine. There you go, sugar in the urine, right? Glyco is like glucose in the urine. Very good. What about ketone? Not sure. Anybody heard of, well, here, I'm going to read you this and then I'll kind of give you a little bit more. So ketone is the presence in the urine of a chemical formed when the body experiences starvation or uncontrolled diabetes mellitus. So anybody heard of keto, the keto diet, ketoacidosis, all that stuff? Yes. So ketone is what causes the ketoacidosis, so to speak. Whenever your body is in ketosis, you're producing ketones, which is why they tell you it's not a long-term diet. You shouldn't do it excessively because then you can go into ketoacidosis and actually become sick. So ketones would be in that. A sign of starvation, there you go. And that's a very good explanation of it, right? Nitrite is a chemical formed in the bladder in the presence of bacteria. So they're all found in urine, but in different diseases, if that makes sense. So these right here, the thing that they have in common is they're all a sign and symptom of a disease of some sort that your body is trying to fight or is losing, actually, because this is being found in your urine. All right, therapeutic procedures, renal stones. Sorry, I don't know why that was so exciting. Hold on. I feel like that went weird. Okay, anyway, renal stones. So you have watchful waiting. Basically, you want to see if your body will pass the stone. If it doesn't, then we have extracorporeal shockwave lithotripsy. I know it's a mouthful, so let's break it down. Lithotripsy, tripsy, anybody remember what that suffix means or want to take a stab at it? Tripsy. I'm wondering, and then I feel like it should be in here. I know we had it. Yes, we did have it. I'm looking it up too because, okay, page 162. Tripsy should be there. Let's see who can get it. To crush, yes. I always like to say to crush or destroy. Another way, okay, you know how I'm all about the like word association. So what I used to use before is you trip and you imagine like a Coke can on the ground. You trip on it and you crush the can. Might be a little bit of a stretch, but it helped me. Like that visual tripsy. I'm like, oh, we tripped. What did we trip on? And we crushed a can. I don't know. There you go. Then that's good. Hey, it worked then. It still works now. And then litho, what are we crushing or destroying? We're crushing the stone, right? Yeah. Shockwave, we're using shockwaves to do that. Extracorporeal, what do you think that means? So in this case, eel is like pertaining to, it's a location. Extra, what do you think extra is? It's outside, right? Yep. Corp, we know is what? The body. There you go. Look at y'all connecting dots. I'm so proud of you guys. Like, let me take a minute. You guys are rocking this. Yes. Beautiful. So let me go back. So yes, extracorporeal shockwave lithotripsy means that we are using shockwaves sent from the outside of the body to crush and destroy those stones, which I don't know about you, that's pretty hardcore to me. Just saying. All right, ureteroscopy, right? I mean, they got so many cool things. I'm just saying. Ooh, I like that, Jaden. That was really cool. Okay, ureteroscopy. Doesn't sound fun. So scopy, process of viewing, ureter. Oh, gee, I wonder what we're looking at. We're looking at the ureters. Ureters. Bleh. All right, percutaneous nephrolithotripsy. Ooh, anybody want to take a guess at what that is? Or do you want me to walk you through it? Oh, I said nephro. Lithotomy. There we go. So tomy, let's break it down. Tomy is our suffix here. Put it here. So tomy is our suffix. Tomy is the incision into. Nephro, the kidney. Yes, surgical incision into the kidney stone because we're going percutaneous. Means we're going through the skin. Yes. Oh my gosh, look at you guys. Proud moment. Yes. Percutaneous nephrolithotomy, excuse me. So we're going through the skin to the kidney to get to excise that stone. And then we finally have open surgery. So what do you guys think is the difference between percutaneous and open surgery? You want me to tell you? We got a long silent pause. Okay, so the difference between percutaneous and open surgery is literally, yes, so it's the invasiveness. So anyone heard of laparoscopic surgery where it's smaller, you're only using small cuts, where we were probably going to be doing that with the percutaneous, versus open surgery, we're like opening it up. Like all the old people that had to like cut across their abdomen, yeah, like open heart, right? We're opening the person up to go in there and do what we got to do. Beautiful. Now with nephrectomy, ectomy we know is what? What kind of removal? Remember, there's 2 words to it. What's that first word? There we go. Surgical removal. Yes. So I got you though. The surgical removal of nephr, which is kidney. So very good. Now there's different types. So there's a radical, like radical dude. No, not quite. Radical is like we removing it. Donor, so if we needed to remove it from somebody who's healthy, who's donating it to someone else, this would be your donor nephrectomy. And then partial would just be if we were removing, like it sounds, a part of the kidney. So we good on that? Sweet. Oh, okay, therapeutic procedures. So we have kidney failure, unfortunately. Kidney transplant provides a better quality of life than dialysis, provided a suitable donor can be found. That's the harder part. And then we have, cystoscopy. Can we talk about that over here? Foley. Kind of not really talking about it too much. This is going more into, okay, dialysis, which is used to treat kidney failure. So we have that. There's hemodialysis, which, what are we doing there? Hemodialysis. What's being recycled? The blood, right? Peritoneal dialysis, that is in the location. Continuous ambulatory peritoneal, which means we're there. Ambulatory is usually what's the word I'm looking for? Not adventuring, but you're exploratory type of thing. Continuous cycling of peritoneal dialysis, and then we have finally kidney transplant, which would work better than dialysis, provided you can get someone. And then urinary bladder, we have cystoscopy, which can be used to therapeutically remove stones, polyps, and some types of tumors. It can also be used in various types of prostate surgery. Let's see. I think you're good on that. Dialysis. So again, we have these types of dialysis is the process of removing waste and excess water from the blood. Hemodialysis involves the filtration of blood through a dialyzer, which is an artificial kidney, so to speak. We have this image 6.9, which is also in your book. Again, I'm looking for, there it is, page 161. You should be able to see this, and this is showing you exactly how your blood comes in from the oxygenated side. You notice we have that red vein right here. Oxygenated is coming through, going through the dialysis machine, all the way through, and then back out. So where was it? Here's your flow meter. How much is going through your dialysis fluid? Let's see. I'm not as much about all the things, the way it works. I want to focus on the terminology and what you guys need to know. All right, identify combining form and suffix of the following terms. So we have lithotripsy. What do you think we're doing there? We kind of talked about this one already. Crushing of the stones. You nailed it. Nephroscopy. Anybody guess what nephroscopy might be? Scopy means we're doing something with the Y, right? That Y ending tells us we're doing something. What are we doing something? We're viewing. We're looking at something. Right, we're viewing the kidney. What about ureteroscopy? Exactly, with a scope. Very good. Ureteroscopy. What are we looking at? That's right there. Yes, they're ureters. Exactly. Remember, sometimes it is just that easy. No, not all the time, but sometimes. Sometimes. Okay, pharmacology. So there's such thing as diuretics, which increase urine output by the kidneys. Renal drugs are used to treat a variety of urinary conditions. Review medication that treat nephrotic syndrome, such as renal cell carcinoma, renal transplant. Non-renal urinary tract drugs include antibiotics, urinary analgesics. Anybody tell me what an analgesic is? Wondering. No clue. Hey, that works for me. Is that something that's in here? I want to know. Because that is something you will see in the field. Analgesic on page 164. Remember we were using the word algia? We're going to make this a teachable moment. So algia, anybody tell me what that means? That was one of our suffixes. Pain, very good. So then if we have algesia, like, did I even spell that one right? So the S in there, think of sensitivity to pain. That's if we put the an in front of it. So an, remember, is no, not without. So algesia is a sensitivity to pain. So analgesia means there's no sensitivity to pain. We're not feeling anything. It's numbed. Does that make sense? See how we kind of work that through? Awesome. Fantabulous. Let's find out where in the world I was. Sounds like great. All right. Let's see. Conditions. I'm totally losing it this morning. Welcome. Pharmacology treatment. So diuretics increase. Renal drugs are used to treat a variety of urinary system conditions. Review medications. We talked about that. Okay. Sorry, I backtracked a little bit. Alpha blocking agents are also other medications that are used. Drugs for STDs include metronidazole, there we go, for trichomoniasis, azithromycin for chlamydia, and intramuscular penicillin for syphilis. It says IM. IM means intramuscular. That's something you'll need to make sure you know. HIV infection has no cure. Highly active antiretroviral therapy, which is known as HART, HRRT. Seeing if they have that up there. They don't. It's a combination of at least 3 drugs belonging to at least 2 types of antiretroviral agents. Let's see. Again, not as worried about this. I just want to make sure that when you see these, you're not shocked. Like, you're not like, I never heard about that. It'll be okay. All right. Define the following abbreviations. Remember I told you you can use your book for this. And we're going to look on page 167 if you have your book. What do you think ARF means? ARF, ARF. Acute renal failure. Beautiful, darling. Beautiful. All right. What do we have next? Cap D. You guys can take your time, write it in. We're not in a rush. And remember, you can be using your books. This isn't a test. This is class. It's where we get to use our books and talk about things. Continuous ambulatory peritoneal dialysis. Very good. Anybody already working towards CKD, which you will hear this one a ton. CKD is when, whether you, and it doesn't matter what field you're going into, you'll hear CKD. I still see some of the Cap D. Yes, chronic kidney disease, CKD. And again, you're going to hear that in the field where they're not necessarily going to be saying chronic kidney disease. They will just purely say CKD. And then that kind of goes in with ESRD, which we'll get to in a minute. So CRF. Which will also kind of precede ESRD. Okay, chronic renal failure. What about ESRD? Now this is when it's to the end of that. So we're beyond chronic renal failure. Yeah, we're talking about end-stage renal disease. Very good. You will hear ESRD a lot too. PKD. We'll wrap it up with that, obviously. And I want to break this one down a little bit. Kristen got it with polycystic kidney disease. Yes. So what do you think polycystic means? And this can be in a lot of different diagnoses, not necessarily just this. You might hear polycystic in other things like more than one what? Yes, many cysts. Beautiful. So yes, polycystic. So it pertaining to, so we're pertaining to, poly means many. Cysts can mean the either a cyst or it can mean a bladder, but in this case we are talking about cysts. So polycystic, many of those. Very good. Look at you guys rocking it. All right, that concludes our lecture for today. I am going to stop recording.